First thing I'm going to determine, this looks to be a nature of illness versus a mechanism of injury. I have one patient. I'm going to consider additional resources. Might call ALS, I'm not too sure at the moment. And I'm also going to consider C-spine. To me, I'm not going to hold manual inline stabilization, but I'll keep it in the back of my head. Then I form a general impression of the patient. Seems to be a mid-20s male, sitting upright, looks to be stable, and also looks to be in a position of comfort. Now I'm going to approach the patient. Hello, sir. My name is Max. I'm an EMT. Why'd you call 911 today?
That's a weird feeling in my chest up here.
You have a weird feeling in your chest. What's your name?
My name is Johnny.
Johnny, where are you right now?
At my house.
You're at your house, and what year is it?
2012.
Okay, so my patient is A&O times 3. Can you hold up 2 fingers for me? Now I know my GCS score is a total of 15, eyes 4, verbal 5, motor 6. I know his airway is patent because he was speaking to me in clear, concise words. His breathing rate seems to have good tidal volume and doesn't seem to be using accessory muscles. But just to be safe, he's having chest pain. I'm going to put him on a non-rebreather mask of oxygen at 15 liters per minute. I'm going to do a visual blood sweep. I don't see any outward bleeding. I'm going to check his pulse at the radial site. Seems to be strong and regular. And check his skins. Take the back of your hand, and looks to be pink, warm, and dry. For the scenario, we'll say they're pale, cool, and diaphoretic. Because of what I've seen, I'm going to make him a priority transport. We're going to transport right away. I'm going to finish my secondary assessment and round. So now I'm going to start my secondary assessment. So when the chest pain started, did it come on fast or slow?
Come on pretty fast.
Pretty fast. And does anything make it better or worse?
No, I just sat down, thought that'd make the pain better, but
okay, you just sit down.
Really
and can you describe the pain to me? Like, what does it feel like?
It's like a brick on my chest, like
a brick on your chest.
Just sitting on me.
And can you point to the pain?
Yeah, it's right here.
It's right there. Does it move anywhere else?
It kind of goes up my neck.
Goes up your neck a little bit.
Into my jaw.
And on a scale of 1 to 10, 10 being the worst pain you've ever felt, and 1 being little to no pain, can you rate the pain for me?
About a 7.
About a 7. And how long ago did this start?
30 minutes ago.
About 30 minutes ago. Have you taken anything?
I took 1 nitro.
You've taken a nitro? Are you allergic to anything?
Penicillin.
You're allergic to penicillin. Do you take any medications prescribed?
Just my nitro.
Just the nitro. Do you have any past medical history?
Yeah, I have heart problems and high blood pressure.
Heart problems and high blood pressure. And what was the last thing you ate or drank?
A burrito about an hour ago.
Okay. And when the chest pain came on, what were you doing? What were you doing?
I was just I was reading a book.
You were reading a book? At any time while you were reading the book, did you fall, hit your head at all?
No, just...
Okay, so now I can rule out trauma. I know I'm not going to need C-spine. So the next thing I'm going to move into is my modified secondary. So the first thing I would do is visually expose the chest. I would check for any scarring, any pacemakers, any other physical trauma I could see. Next thing I would do is I'm going to go ahead and palpate. So go ahead and take a deep breath for me. Does that cause any extra pain?
No.
Take a deep breath. Is that causing any other pain?
Nope.
Can you lift your arms out like this and start moving back and forth? Is that causing any other pain?
No.
Okay. Next thing I'm going to do is auscultate. The 6 points that we're going to auscultate is mid-clavicular line between the 2nd or 3rd intercostal space bilaterally. Also mid-axillary line, 4th, 5th, or 6th intercostal space bilaterally. And subscapular bilaterally. After we've done our modified secondary, we're going to move into baseline vital signs. For the scenario, we'll say his vitals are, pulse is 90, blood pressure is 142/90, skins are still pale, cool, diaphoretic, eyes are pearled. So based on his modified secondary and his vitals, I know that his BP is over 90 for the nitro. His pulse is between 50 and 100. He going to check the fibroids. So the fibroids would be the right patient, the right medication, the right date so that it's not expired, the right dose, which should be 0.4 or 0.3, and the right route, which is sublingually. Last two questions I'm going to ask the patient. Sir, have you taken any sexual enhancement drugs in the past 48 hours?
I have not, no.
Are you taking any pulmonary hypertensive drugs
Nope.
in the past 48 hours at all? Okay, so because he hasn't taken those medications, I know that I am clear to go as a standing order. He's only taken one dose, so I can administer another one. Just what I'm going to do is just take one, place it in the patient's hand. Go ahead and put that under your tongue, let it dissolve, and do not swallow. After that, we'll wait 5 minutes, and then we'll reevaluate the intervention. After we've done our interventions, we're going to reevaluate our transport priority. He's still a priority. I'm going to keep him going to the hospital, and then we'll move into our reassessments. So I'm going to reassess my primary assessment, which is my level of consciousness, my GCS, my ABCs, reassess vitals every 5 minutes, but because chest pain seems to be cardiac in nature, I'm going to check his vitals every 5 minutes, reassess my secondary assessment, and reevaluate the interventions. Good?